We are live now, doctor.
Hello. Okay, great. Good evening, everyone. Welcome to the second episode of Fellows Face Off. We thank the Governing Council of YOSI for giving this platform and allowing us to have this wonderful Fellows Face Off for fellows all across the country and as well as international fellows. So we are the team. I am the team lead, Dr. Apurva Ayachit. I'm a retina surgeon at Joshi. Then we have Dr. Ashish, Dr. Bhavya, Dr. Gunjan, and Dr. Sunandini Bose. This is the first of its kind format in quizzing in India, at least in opthal circles. This is the Jeopardy format. And it is based on the extremely popular US show called Jeopardy. And it's an answer question format of quizzing, where so here the host presents the categories and the answers, and the team gives us the questions. It tells us what we are talking about in the form of a question. Suppose the quizmaster says this condition is characterized by T sign. The correct response by contestants, which will win them points, is what is the ultrasound finding of posterior scleritis? Anything close to the answer, which can have multiple answers, anything that is grammatically coherent is encouraged. Jeopardy is a point gifting format. It is not very strict. As in, if they forget to make a question in the first round of Jeopardy, it's still okay. But in double Jeopardy and final Jeopardy, it is highly recommended that you form a question because you may lose points for that. Why I'm saying is this: the other response by the contestants can be what is the ultrasound finding in panophthalmitis, which is also correct. So the final verdict will be given by the judges and the panelists and the quiz masters. In this case, Gunjan and I. So what is jeopardy? Jeopardy, the word means that there is danger of loss, harm, or failure. For example, the whole peace process is in jeopardy, or your whole game is in jeopardy, your whole points are in jeopardy. So jeopardy means fear of harm, fear of loss of points in this case. So the jeopardy, which I need to caution to you about, is that the correct answer will give full points, and the points are very high, large in number. There are hundreds of points for each question. And if you're wrong, the value of the points will be deducted from your score. The same value, plus 100, minus 100, plus 1000, minus 1000.
Biology.
So this is an
ABCs.
example.
Biology for 16. B. This pig. B. This pigment gives bile its yellowish color and can lead to gallstones. Ben.
What is bilirubin?
Correct. You're out of the hole.
Biology for 12.
A. You get one set of these alternative forms of genes from mom and one from dad. Victoria.
What are alleles?
Correct.
Biology 2000.
CC. Two-word term for the multi-stage process via which the basic unit of life reproduces itself. Victoria.
What's the cell cycle?
Correct.
Biology for 8.
Answer there. The other name is double. Last one in the game, Bruce. So
This is the daily double.
It's better not.
Putting it all on the table. In biology, ABCs. Here's your clue. C. In myth, it's a fire-breathing hybrid monster. In genetics, it's an organism with two distinct sets of DNA.
What is chimera?
Chimera is correct. This game just got a lot twisted.
Biology ABC is 400.
A. This clear fluid surrounds a baby in its mother's womb. Victoria?
What is amniotic fluid?
Yes. For more great Jeopardy videos,
Hit the subscribe button.
file.
So the first cell is chosen by the quiz master and it's posed to a random team. The team should answer within 3 seconds. You cannot take more than 3 seconds. By then, the other teams can flash their LED light. If the team to which the question is posed does not answer, the other teams who flashed can get a chance. The one who flashed first get a chance to answer the question first. So if the teams fail to answer correctly, they lose the same number of points. If nobody flashes their light, the question dies. The next cell is chosen by the team with the lowest score. So keep flashing your light as soon as possible if you know the answer or if you want to take a chance. So to keep adding to your score, we have hidden daily doubles. In this game, there's only one daily double, that too in double jeopardy. There is an example of daily double in the previous video. If you're lucky to uncover, you will have a chance to double some points. For example, you want to double 200, you have to tell before only that you want to double 200 or 400 or whatever it is. Or your entire score also you can double if you're very sure of your answer. But you will also lose the same number of points if you don't answer or if you tell wrongly. So double jeopardy is the next round. This was all jeopardy. Double jeopardy has different categories of prompts, completely different from first round. The values of cells is not 100 to 500, it's 200 to 1000. Okay, so double number of points. Last is final jeopardy. There's only one single prompt. In that you have 90 seconds to think about it, and the correct response must be strictly in the form of a question. And on your white paper, you're supposed to write your question and write the number of points that you want to bet. The minimum number of points you want to bet is 100. The maximum can be till your total score. If you have 10,000 points, you can bet the entire amount. You'll get 20,000. Okay. You'll get 10,000. I'm sorry. There's no doubling here. Okay. The wrong response, you lose 10,000. Just an example. So the winning team keeps their final points as the starting point of their scoreboard at the finals. So you may be having 10,000 points. The previous episode's winner had 9,000 points. So you already have 1,000 point advancement. So let's play now. Okay. I'll just stop sharing for 1 second. Go to the Jeopardy. Yeah. So this is the first round. Round 1. Yes. Let's continue. Cool. Okay, now let me share my screen. Can you see this? Can you see the board?
Yeah.
Yes, ma'am. Can you see it in full screen? As in at least whatever you're seeing. So when I'm using the board, Gunjan, I will not be able to see all the teams, but I'll try anyway. It's okay. So Nandini is also here. Great. Yes. Sorry? Okay. So the first question I'll be posing to team NN. Choose a cell. NN.
Pediatric of the 100.
Roll, pitch, and yaw. Other teams can flash.
Any
You take
flashes?
too long to answer. It's
Any
very
flash?
basic. Sorry, don't know. I don't mean to intimidate you, but this was pretty basic. Roll, pitch, and yaw. Pediatric ophthalm. Any questions? No? So this question dies. Let's all agree. Team NN loses 100 points. The correct answer is, what are the 3 dimensions of AHP measurement? Anomalous head posture measurement. Pitch is anterior posterior or flexion extension. Yaw is lateral rotation. And roll is lateral flexion. Okay, so yeah. So team NN can choose the next cell.
Ma'am, corner is 500.
A culture media that differentiates between lactose fermenters and non-lactose fermenters in microbial keratitis. So random, right? Yeah, good. Team Shankara?
Team SN, SEC.
Shankara.
Yeah, Shankara. Team Shankara. Yeah.
I'm sorry.
Yeah, they were right.
Okay, great. They answered exactly. What is McConkey agar? You should make it a question, okay? You should make it a question. What is McConkey agar? All right. I'll let, okay. So Shankara, choose the next cell, please.
Glaucoma 100.
Gunjan, you want to read this out?
So this non-valve glaucoma drainage device manufactured in India.
RD. What is RD?
Perfect. Correct. So ideally, we wait for the response, the prompt to be read, but it's okay. You're excited.
All right, they would have read it.
What is RD? Good. All right. Shankara.
Retina 100.
Retina 100. So these are the common causes for sudden DOV, trauma, PVD, vein occlusion, PDR, vasculitis, lifting heavy. Yes,
VA. Vitreous, what is
correct. 10.
vitreous hemorrhage?
Fantastic. Great.
Filters.
Let's not wait for me to read the question out because a lot of people are flashing. So let's allow
Okay.
for me to read it out. Okay, great. Awesome. Shankara, next cell.
Glaucoma 200.
Glaucoma 200. Great.
Glaucoma 200.
This is your prompt.
Where will be the this is what is inferior arcuate scotoma?
I'm sorry, that's wrong. Any, yeah, NN, go ahead.
Altitudinal field.
Yes, that's right. That's right. Yeah, so make it a question, please. Let's practice.
What is altitudinal field?
Yes, what is altitudinal field effect? That's correct. And then your next cell.
Okay, don't
Retina, retina 200.
Vitamin C, E, copper, lutein, zeaxanthin, zinc.
What is ARIDS?
I'm sorry.
What is ARIDS?
Can you modify a little bit?
What is the content of
No,
the
that's
tablets
not-
in ARIDS?
Okay, I'll give it to you because we are in the beginning of the game. But what is ARIDS?
ARIDS 2. ARIDS 2. Okay.
Not beta carotene was in ARIDS, right?
Yeah,
So I'll give it to you because we're in the middle of, in the early part of the game. So go ahead and then choose the next cell.
Cornea 200.
Gunjan, do you want to read this question?
So the most robust risk factor for ectasia after LASIK
Thin
in
cornea.
with normal preoperative corneal topography.
I'm sorry, and then what did you say? Thin cornea. You should not respond. That's why. So, Shankara, please go ahead. You have flashed.
High refractive power.
I'm sorry, that's wrong. Yeah, Ankita. MMJ.
Contrast keratoconus.
I'm sorry, that is wrong.
It's normal.
Basic in patients with no.
Yeah, I think all of them have answered wrong. So let's
Yeah.
read.
So,
What is the percentage of tissue altered?
yeah. So that is Gunjan's the expert in that. Most robust critics factor. You really think we are going to ask those questions where you say thin cornea or formfrest keratoconus? This is normal cornea. Remember, this is normal preoperative topo.
Normal.
Right? I'm sorry.
Sorry. So you have to be like little bit more specific because we are answering the quiz, right?
Okay.
Okay, great. So let's go ahead. Now we have team MMJI because this question has died. MMJI has the lowest score. Go for it. Which cell do you want?
300.
Retina 300. A patient with low vision, fundus findings are not explaining the low vision. He has this finding on FFA.
Macular ischemia in
Yeah, please
diabetic
make a
retinopathy.
question. Make a question.
What
Make
is the how does FFA looks in a macular ischemia in diabetic retinopathy patient?
Okay, fine. Not like that. What is ischemic maculopathy?
Yeah, all right.
Yeah. Okay. Simple. Okay, MMJI. Next cell.
Pediatric 200.
Pediatric 200. MMJI. This is for you. Look at this carefully.
Ma'am, 1 second.
You want us to zoom more?
Let me see.
Can you just
I think it's pretty visible. Okay, let me zoom it more. Yeah. 1 sec. Yeah, go for it. Can you see now?
Team Sankara. Team
What are
MMJ.
the normal 9 phases?
Who said that? Who said that?
MMJ.
MMJI loses points for this. 1 second. Am I not able to? Yeah. MMJI loses. Any other?
Team Sankara was flashing light. Do you want to answer?
DRS
Flash?
with upshoots.
Sorry?
DRS with upshoots.
No, I'm sorry. You see all the 9 gazes, no? There's a very obvious IO overaction. There's a very obvious pattern there. So SEH loses, MMJI loses. So the answer is, it's a very standard thing. Don't blame me for this. What is seen in left SO palsy? Okay. So you can see a left IO overaction. There is no DRS in this. There is no deficit in any gaze. Okay. All right. Next question. Yeah. Okay. So who is choosing the next one? Why is this not Zoom? Yeah, there it is. Okay. Team SEH, next cell.
Retina 400.
Retina 400. Wedge-shaped herpetic retinitis in the periphery. This predisposes to retinal detachment. Nobody is flashing. It's so simple. Everything is.
ARN, acute
So tell me the
acute
question.
retinitis
Please make
necrosis.
Make a question,
What is
please.
ARN? What is ARN?
What is AR? Yeah. So SEH,
What is
right?
ARN?
Yeah. To get 400 points. Please go ahead and choose the next cell, SEH.
Retina 500.
Retina 500. Here's your question. Pattern of vitreous haze includes aurora borealis and string of pearl appearance.
Yeah.
Candida endophthalmitis.
I'm sorry?
Candida endophthalmitis.
What is the characteristic feature in Candida endophthalmitis?
I'm sorry, that's wrong. MMJI flashed first.
What are the fundus findings in primary vitreoretinal lymphoma?
Fantastic. That's correct. That's correct. What is vitreoretinal lymphoma? Perfect. MMJI, you choose the next cell.
Oculoplasty 100.
Oculoplasty 100. MMJI, right?
Yeah.
Okay. This material is harvested for this surgery. Yeah, MMJI. Go ahead. MMJI.
What is the material harvested for
I think too much.
So
One
there's
second. There are too many people speaking at the same time. Let me call upon you and then you speak. MMJI is speaking. Yeah.
What is the material used for YOSI surgery?
Correct. Exactly.
Surgery.
Yeah, exactly. So what is an autologous material used as a sling in congenital ptosis? Okay, no problem. MMJI, your next cell.
Pediatric 300.
I'm sorry.
Pediatric 300.
pediatric.
Pediatric 300.
A rare constellation of ocular oscillations, head nodding and torticollis. Starts at 4 to 18 months, disappears at around 3 years of age. MMJ is not answering. NN has flashed.
What is passive mutants?
Fantastic. That's a good, that's a very good response. What is spasmus mutans is correct. Great. And then your next cell.
Cornea. Okay, cornea 300.
Trivia. Trivia for what?
Cornea 300.
No, cornea 300.
Gunjan, go ahead.
Yeah. Okay. So what
Which is the procedure used for recurrent cornea? It's a diamond burr.
What is diamond burr used for?
What is diamond burr used for?
Yeah.
This is your prompt.
What is
What
diamond
is
burr?
diamond burr used for?
Perfect. Very good. What is diamond burr? Yes, you're right. Correct. So next, NN.
PDF 400.
See, I think it's going to go. I think you should be very quick in choosing the cell. Come on.
PDF 400.
PDF 400.
400. Okay.
Okay, this bow tie suture allows for post-operative adjustment. Look at the suture.
What is
NN
a
is
sliding?
not sliding knot. I cannot give you that. MMJI has flashed.
Adjustable sutures.
No, okay. Adjustable only. हाँ, तो adjustment लिखा है उधर. Adjustable ही है. I'm sorry. SEH, did you flash? These are very standard quiz questions. SEH did not flash, so this question has died. What is a Jampolsky adjustable suture? Okay. So the next question, SEH can choose the cell.
Glaucoma. Glaucoma 300.
Is it my connection or is it your connection? I don't know. Let me just come back. I'll disconnect and come back, or is this okay?
Yeah, let it be. We are here. आपको नहीं lag आ रहा है? You are having a lag?
Okay.
No,
Fine.
we are not having lags.
Okay. SEH.
Glaucoma 300. He said
No, it's, I mean, for me, okay, great. Glaucoma 300. There you go. This is your prompt. So this person.
Name
Discovered
Sankara.
application tonometer.
Okay, NN has flashed.
Yeah, NN flashed.
NN has flashed.
Who discovered applanation
Applanation
tonometer?
tonometer.
Goldman. Who discovered Goldman applanation tonometer?
Who discovered applanation tonometer?
Ma'am, are we audible?
Hello?
Yeah, it's audible. I think
Hello?
Dr. Purva has. Just hold
Hello,
on.
hello.
I think Dr. Purva has.
Ma'am, we answered.
Yeah, I know. Wait a minute. Dr.
You
Purva.
tell.
We were
Who
asked
discovered
actually.
applanation
Team
was-
NN was asked.
So
Yes,
guide
that's-
2, who was Hans Goldman? Yeah.
They said who discovered Goldman or
Ma'am, actually NN answered. We answered that before them.
No,
Because we were asked.
We were asked.
We were
actually.
asked.
Actually,
So we
Discovered
answered.
Goldman
basically-
applanation
Hold
is
on,
the
Dr.
response.
Purva is
How it
having
is.
some network
Last
issue.
one.
Hold on. Let me do it. Hello? Dr. Purva, are you having some lag here?
Ma'am, we were at 300.
Wait, I'll call her.
Ma'am,
I'll call her. Wait.
ma'am, but
So,
it was our
so team NN
question
answered first,
and we
and the
answered.
question was also directed to them.
Can you hear me?
We have to give the point to them.
So we were at 600.
Yeah. 300.
No, John lag है.
Sorry, Nati.
Are you there?
Yes, ma'am.
Are you there? Am I there? Can you
Actually,
hear
we
me?
are not able to see you, ma'am.
You're
not able
having
to see your
some
screen.
lag in your connections, basically.
You see?
I'll let her join back.
Let her join back then. Wait for some minutes.
Not audible, ma'am. Mute.
Sorry. Can you see me now? Can you hear me
Yeah.
now?
Yeah.
Yes.
I thought they said who discovered application tonometer. Correct?
Goldman, we said.
Yeah,
After
he said
that, we
Goldman.
said.
They said who discovered or Goldman at tonometer.
Who
They said.
Discovered Goldman applanation tonometer.
Yeah.
That's the whole point. Who
Yeah.
discovered it?
Yeah.
Okay, so it doesn't mean you told the correct answer.
Yeah, you answered first, but
Yeah.
the answer was not correct, Team NN.
So even a 5-year-old will say I mean not a 5-year-old, but at least a first-year-old resident will say who discovered this. We know that is the discoverer. So who is Goldman bolna chahiye na? Who is Hans Goldman? You're not understanding the format. You have to name the person. Okay. That is a traditional quiz. Now, if it was a traditional quiz, suppose they showed you this, you will say Hans Goldman, no? Correct?
Yes.
Huh. So in Jeopardy, it's okay if you had said Hans Goldman. But who discovered applanation? Nahi. Just because you want
Ma'am,
to
we said
question.
discovered Goldman applanation tonometer. Still
You
doesn't
didn't
count.
answer the whole scientist name, no. It
Yeah.
was not
So
like
wo Goldman
Goldman
nahi
to
hoga
everybody
na.
will say, no. Then what is the format for? It
I
is
can't
that-
give.
Yeah.
I can't give this. Sorry.
Goldman anyone can say. So what is the
Yeah.
idea behind having
Ah,
this?
exactly.
So,
Ma'am,
okay, let us make this very clear. Guys, listen to me. So, if to make this easy for you, answer it first. Okay. Say, suppose this was shown to you in a traditional quiz. Okay. Say Hans Goldman. It's okay. But just because it is Jeopardy, you had to say who is Hans Goldman. Okay. Simple now. Suppose I show you something. Say the answer. Then make a question. No problem. Okay. Okay. So team SCH next.
Ophthalmic trivia 100.
Okay. This saxophone playing surgeon who got his inspiration while sitting in a dentist chair. Okay, MMJI is flashing.
Charles Kelman. Who is Charles Kelman?
Charles Kelman.
Yes, exactly. Perfect. Who is Dr. Charles Kelman is right. Did I give you points? Not yet. Okay. So MMJI next cell.
Ophthalmic trivia 200.
Okay. This famous ophthalmologist got the idea for his groundbreaking innovation from plastic shrapnel from the cockpit canopy. Hold on, and then I'm coming to you. Staying in the eye for several years.
Harold Ridley. Sir Harold Ridley.
Who is Sir
Sir
Harold?
Harold Ridley?
Yeah, perfect. Very good. So let's look at the who is Harold Ridley. It's correct. Next cell.
Cornea. You have to go to oculoplasty 200.
Okay, oculoplasty. Bone, or it also has oculoplasty, ocular oncology. Okay, so bone in the eye, pseudo-optic nerve shadow. So this is also oncology. That's why. SEH has flashed. No, I'm sorry. That is wrong. SEH, please go ahead.
What is caudal osteoma?
Very good. So SEH has answered.
Correct.
Yeah. So SCH is correct. What is choroidal osteoma? Next, SCH, please choose the cell.
Oculoplasty 300.
Oculoplasty 300. Ocular oncology, oculoplasty. That's the thing. Full thickness cutaneo-conjunctival flap for full thickness lid defects more than 50% of the upper lid. Who is
Cutler bed.
Yes, Shankara. Good. Make a question.
What is
Cutler bed?
Very good. What is Cutler beard bridge flap? So SCH has answered. Next question. SCH, please choose the cell.
Ophthalmic trivia 300.
Okay. One man's vision became the guiding force for the biggest model for sustainable eye care. This book is extremely famous. Come on. This is one man's vision. Ophthalmologist. Nobody is flashing also. Shame on you. Shame on you. Come on, guys. Don't let this question die. Come on. So, which is the biggest model for sustainable eye care in the world? Somebody. Anybody? Arvind Eye Care System, dudes. Who is Dr. G. Venkatswamy, also known as Dr. V? If, as an ophthalmologist, you have not read this book, I highly recommend that you buy it today. Okay, because MBA, IIM people read this book, Harvard Business School people read this book. Harvard, which is the biggest model for sustainable eye care. Please. Okay. Right. Shankara loses points. Next, let's make MMJI choose. Or no, Shankara choose. Shankara has the lowest score.
Orbit 400. Ocular oncology 400.
This is an infographic for this procedure. Let's look at the procedure. I'll zoom out for you. Yeah. Can you see it?
Mohs micrographic surgery.
What is Mohs
Very
micrographic
good.
surgery?
Superb. Superb. Exactly. What is Mohs micrographic surgery is absolutely correct. Next cell, please choose Shankara.
If you know the answer, just
Glaucoma 400.
Huh?
Glaucoma 400.
Glaucoma 400 is here. You can just look at the type of perimetry. Don't have to interpret it.
Kinetic perimetry.
Yes, exactly. What is Can you make it better?
What is Goldman's kinetic perimeter?
Excellent, excellent. So SCH wins points for this. SCH keeps continuing to choose the cell.
Glaucoma 500.
Glaucoma 500. Seen in hypotony, seen in elevated episcleral pressure.
Blood is canal.
What is blood? When we see blood,
When
Yeah.
do we see blood in Schlemm's
What
canal?
are the causes of blood?
Yes, perfect, perfect. SCH is doing very well. Exactly. So what is blood in Schlemm's canal? SCH, go on. Finish the board, SCH. Finish the board. Come on.
Ophthalmic trivia 400.
Yes, this Canadian ophthalmologist developed use of CCC, continuous curvilinear capsular access, and divide and conquer. Nobody is
Right.
Team
very wrong. SCH is wrong. Anybody else?
NN flashed. I
CC.
saw your flash.
it was a false alarm. By mistake, he pressed the.
कोई बात नहीं. Answer करना है नहीं करना है. नहीं करना है. छोड़ दो. Hey, come on, Gimbal and Newhan. Gimbal, who is Howard Gimbal? Gimbal and Newhan are our gods in cataract surgery. Okay, Rexis कर रहे हो तो Gimbal का नाम लो, Rexis ठीक हो जाएगा. Just say Om Namah, go Howard Gimbalaaya Namaha. Your Rexis will be perfect every time. Next, I think we'll go for Team NN.
Corner refractive. 400.
400. Green circles in my eye, my liver enzymes high. My gait is short, but alcoholic I'm not. And then you have 3 seconds. MMJA has flashed first.
What is the features of Wilson's disease?
Very good, Anju. Team NN has won this. Very good. What is Wilson's disease? Green circles in my eye. Excellent. So next cell, NN.
Pediatric 500.
So this partial tendon transposition of vertical recti is used to strengthen horizontal recti in paralytic strabismus. Let's look at the illustration. Yeah, Shankara has flashed first.
What is Samashi's procedure?
Who said that?
We only.
NN only. Very good. That's correct. So what is Hammersheim procedure is absolutely correct. Next question. NN. Finish the board, NN.
Yes, ma'am. Corner refractive 500.
Good. A somewhat controversial. Gunjan, please go ahead.
A somewhat controversial technique where decimus is removed without endothelial.
What is the decimal stripping only? DSO.
All right.
Very nice. Superb. Fantastic. So you're doing really well. The answer is DWEC or DSO. Correct, Gunjan? Yeah.
Yeah, correct.
Desmetorexis without endothelial keratoplasty. DSO. Also correct. Come on, NN. Next.
Orbit
500.
Orbit 500. Okay. So S100, HMB45, Milan A, tyrosinase, MMT. I think Shankara has flashed.
What are the histopathology features of rhabdomyosarcoma?
Shankara, no, right?
Melanoma.
What are the
Yes.
Histopathology features of melanoma?
Who said melanoma? SCH. Fantastic. SCH and SCH gets it correct. Immunohistochemical markers for melanoma.
And then answered wrong.
Yeah. I minused it for them. 1400 minus. Yeah. Ophthalmic trivia 500 SCH.
Okay, ma'am.
This eye doctor turned dictator was president of Syria for 24 years. Anybody? Arey, famous ophthalmologist who did other things in life you don't know what? All-rounder ophthalmologist. बहुत है ऐसे, बहुत. आज जाके Google करो. Ophthalmologists who had other professions. Who is Bashar al-Assad? Okay? Yeah. Right. So we have finished board 1 of Jeopardy. Now I'll stop sharing for 1 second and we'll go to double Jeopardy. It's 7:35. We need to finish double Jeopardy in only 25 minutes. We can't take
Just a minute.
Yes.
You didn't cut the point for Shankara.
Oh, I'm sorry. Okay. Yes. Good. Well spotted. Thank you. Okay. So now.
Don't want to sound mean though.
No. Hey, very good. You should be very cutthroat. Good, I'm
अपना
happy.
पॉइंट आए या ना आए दूसरे का पॉइंट
दूसरों
कटवाना
का
है
काटना है. दूसरों का काटना है. Exactly. Whatever double meaning, whatever bad word, no problem. It's okay. Yeah, come on. MMJI, choose your board. Choose your question because you have the lowest score. Let's get everybody's scores correctly. Now, let me add 900 points to NN. SCH has 400 points and MMJI is 0. Now we'll build on this, okay? So double jeopardy, MMJI, choose your question. Choose your cell.
Surgical videos.
Surgical videos. Okay. Give me 1 second. Can you see the videos?
No.
Okay. 1 second. I just stop sharing.
But
And
what
I
was
share again.
that you said? Surgical video?
What? How much? Surgical video?
Sorry?
200?
200. Okay.
This is MMJI, right?
Yeah.
Okay.
It's at 200, right? Okay.
Yeah. Can you see this?
Yeah, but it's not full screen, no?
Okay, it's not full screen. Okay. Can you see this now?
Not yet. It's not full screen yet.
It's not full screen yet. Are you sure? 1 second. Let me stop sharing again. And let me show this. Now, can you see?
Yeah, but the video is.
I'm playing. I'm playing.
Okay.
Yeah. Yeah. No, I'm sorry. I'm sorry. I cannot give you. Shankara has flashed.
Yes.
Sorry? Shankara? No. MMG, you're done.
MMJ can't answer.
Desmetopexy.
No, we can't give.
We can't give you.
Can't give that.
Anybody else?
Anybody? No, right? Okay. So we'll go back to our board. So you chose videos 200. It should be corneal compression sutures. It's a very standard video.
Suture desmetopexy, ma'am.
No, you did not say suture. We did not hear it.
Desmetopexy.
Sorry, it is not suture desmetopexy. It's called compression sutures.
I told before the video played.
Okay, so SCH points. Gunjan has the final say. It is her question. So most
but it's not
answer.
right.
Yeah.
Changing their answer also.
No changing answers, guys. Okay.
MMJI points are not mine.
Yeah. Cut. नहीं हुआ. ठीक है. Very good. Yes. MMJI. MMJI. Go ahead.
Trials in ophthalmology. 200.
200. Okay. No association between stress, systemic infection, sunlight exposure, menstruation, contact lens wear, eye injury, and ocular recurrence. Gunjan.
Trial. What is heads to?
Yes.
What is heads to?
Okay.
Trial.
Yes, you're right. Go ahead. What is heads to trial is correct. Choose the next cell.
Trials in ophthalmology 400.
Gunjan, please take it from here.
IV steroids accelerate the visual recovery but do not change the final visual outcome. Oral steroids result in rate of recurrent optic neuritis.
MMJI already
ONT trial.
Huh?
ONT trial.
Fantastic.
What is ONT?
Yeah.
Yes, you're right. MMJI gets it. What is ONTT? Next, MMJI.
Trials in ophthalmology 600.
These two are the prompts, are trials to establish safety and efficacy of ranibizumab.
Marina and Anchor. What are the...
Excellent. Great. So that's the correct answer. What are Anchor and Marina trials? Good. MMJI doing well. Next. MMJI.
Surgical videos 400.
Okay. Let's go with surgical videos 400. I'll stop sharing for a second. Go to the videos. Now I will share again. Yeah, I'm going to play it now. Can you see it?
This is
Anybody flashing?
Yes, and then
NL has flashed.
Yeah, Team NN, can
And
you?
then go ahead.
The placement of malluvian ring.
What is my
No,
What is malluvian?
no, wrong answer. Subtract.
MMJI loses more points.
NN loses point.
NN also.
NN
MM
also.
shows the cell, so they also lose.
Yeah, both of them.
Yeah. So anybody wants to take this?
seriously?
Shankara? No, right? Okay. What is a Zepto-assisted Rexis? Is correct. That's a Zepto device.
I
I'm
don't-
sorry. Yeah, Zepto only, no, Gunjan?
Yeah, Zepto.
Okay, great. So next, I think SCH has to choose the next cell.
We cannot see the leaderboard yet.
Oh, right. 1 second. Job share. Oh, share. And there you go. Go on.
Okay.
Ocular manifestations of systemic disorders, 200.
Berlin nodules and candle wax drippings.
What is sarcoidosis?
Because of sarcoma.
Excellent. That's right. SCH wins. Okay, next.
Systemic disorders, 400.
Gunjan, go ahead.
Okay, the signs associated are in Roth, Mobius.
Thyroid associated or bytopathy.
What are the signs of
That's correct. What is TED? Is correct.
Try to formulate the question also. When you
Please make a question, no? Now that you've got the hang of the game. Come on, SCH. Next cell.
Systemic disorders, 600.
So,
SLE retinopathy. What is the feature of SLE retinopathy?
I can give it to you, no problem. There are multiple causes. CFAN is also a feature of SLE, but I mean, one of the standard things is sickle cell anemia. So I gave you points, right? Correct. So next, SCH.
Systemic disorders, 800.
Melanocytic haematomas of the iris, skin macules, bag of worms.
Neurofibromatosis.
Which one?
Which one?
NF1.
Yep.
NF1.
what are the features of it?
Great.
Yes, absolutely. Okay, perfect. Very nice. Go on, SCH. Next. क्यों 1000 से डर गए क्या?
Surgical videos, 600.
Okay, 600? Okay.
Yes, ma'am.
1 second. Yeah. This is the third one. Okay, share screen. Yeah, can you see the screen? Yeah, go ahead.
Membrane peeling for macular macular
Can you
Bimanual membrane peeling, ma'am.
That's correct. What is bimanual surgery using chandelier? Correct. Very good.
800.
Yeah. Did I add points? Not yet. 1 second. SCH is
Wait. Points add हो जाने दो.
नहीं 1 second. Sorry. 1 second. 600 का हो गया ना, तो इसका मतलब 600 ऐड होगा. ठीक है. Next, SCH. SCH is like galloping.
Innovations in ophthalmology, 200.
Innovations,
I
200.
think Gunjan, go for it.
Okay. So new generation IOL, which is a purely refractive designed to correct the presbyopia, meaning it achieves the depth of focus by focusing light solely through the curvature. And it's similar to a standard
EDOF.
Make a question.
While offering improved.
What is EDOF IOLs?
Good. Yes, Gunjan, they got it. What is EDOF IOL? Okay, go ahead. SCH.
Innovations, 400.
Innovations 400. Collagen implants in cornea. Gunjan, please.
Yeah, it's okay. Collagen implants in cornea associated with Gupta technique.
These are all very high-flying, very hot topics, right, Gunjan?
Yeah. Cornea.
मुझे अभी पता चला.
Team NN, you have a cornea person with you. Come on, answer it.
Nobody.
Lenticule conference, Congress, yeah?
Lenticule Congress था ना तुम्हारा अभी?
Yeah, they had it.
हाँ, छोड़ो अभी SCH loses points. Nobody else has answered. So we'll reveal the answer. What is the xenia implant? Gunjan, can you tell 2 lines about this?
Yeah. So it is useful in keratoconus patients. Nowadays, people like not a lot of people in Western world are using it. So it's like some people are using it with cross-linked implants as well. So it's also useful in progression, stopping the progression and additive procedure to give strength to the cornea.
Great, great. So now NN chooses a cell.
Surgical videos 800.
Surgical videos 800. All right. One.
What is Macular lens? Sorry, goniotomy. What is goniotomy? What is goniotomy?
This is SCH, no?
No,
NN.
And
NN told what is goniotomy. Can you be specific?
direct visualization goniotomy.
Goniotomy assisted
Gonioscopy.
assisted.
No, it is goniotomy. What is
goniotomy?
goniotomy?
What is goniotomy?
Okay.
What is goniotomy?
There's something being inserted there, I think.
There is a blade.
Can we give it to them, Gunjan? I don't think we
Yes,
should.
we can give
Okay,
Can
so it is an eye stent microcatheter.
yeah. So if
I don't think we can give it to them.
they're not answering.
Okay, we'll give it to them. They said goniotomy. I think we'll give it to them. It's okay.
They're giving it.
Okay.
It's
All
not
right.
goniotomy.
It's not. Who said it's not? कोई बात नहीं. अभी next choose करो NN. Too much
trials.
Trials.
Board leaderboard is not there.
It's not there. Oh, sorry. Yeah, trials.
800.
Who is choosing? NN is choosing. Trials 800. Gunjan, go for it. Gunjan, go for it.
A 25% decrease of IOP from baseline reduced the risk of progression by 50%. Risk of progression decreased 10% with each 1 mm Hg IOP reduction from baseline. The thin central corneal thickness was a risk factor in POAG, and low blood pressure was a risk factor in normal tension glaucoma. Team NN.
Shankara has flashed.
Yeah, Shankara.
Shankara.
Early manifest.
Excellent. Great. That's correct.
We answered. Team NN answered.
Ma'am, we answered.
We answered.
Oh, sorry. I didn't know. Not N.
But they exceeded the time, no?
You didn't.
Yeah, ma'am, but the time was
much
actually over.
Yeah, it's too much.
Ma'am, we answered, ma'am.
Okay.
Okay, I'm giving it to NN.
Ma'am, last time also it was like that only.
बहुत देर लगाते हो यार तुम लोग.
इतना देर नहीं लगा उठे भाई.
Actually, there's थोड़ा lag.
Lag हो रहा है मैम.
Okay.
No, ma'am.
Only you 5 people have
That was
that.
the
में lag question में lag नहीं है.
Okay.
हाँ?
जब चाहिए तब lag आ जाता है.
Yeah.
Exactly, ma'am.
Surgical videos 1000.
It's okay, you'll still win. A lot of points are there.
Celebrities
and ophthalmology 200.
Okay, great. Gunjan, go for it.
Okay, so this actress had corneal epithelial damage due to contact lenses and went viral with her bandaged eye pictures. Oh God.
No, but this was very famous for a while.
Yeah, I know. Like, they don't know this.
Where it was like.
Don't use Instagram also.
Okay, Shankara. Shankara.
Jasmine Basing.
Super. That is Shankara, right?
Yes.
Fantastic. That is exactly who that is. Who is Jasmine? Shankara, go ahead. See, I told you there are a lot of points to be won. Come on. Yeah, another 5 minutes, we'll finish. I'm cutting this.
Surgical videos 1000.
Okay, good.
My God.
Finally. Yep. This is an interesting question. Trust me.
Simulation, no?
This is simulation.
Yes.
Can you
Simulation training.
Okay,
IC surgical simulator.
fantastic. That's correct. Absolutely correct.
I said.
Okay. Can you see my screen, guys? Can you see my screen? Okay. Now SEH gets it right. So go ahead, SEH.
Celebrity is
देखो
400.
जैस्मिन बसिन पता है तुमको सब आता है. Don't worry.
400.
Celebrities? Okay. Chess star Hendrik Mecking, Chef C. Sean Brock, and Amitabh Bachchan.
You have given the answer to them.
Myasthenia gravis.
NN has flashed and answered. Okay, let's give it to them. What is myasthenia gravis?
NC United is like answer paise.
NN, choose the next cell.
Celebrity 600.
Celebrity 600. This is a daily double. So do you want to, this I'll give you double the points for this. Celebrity 600 means I'll give you 1200 points if you answer correctly. MMJI has flashed. But
Ma'am, Shahrukh Khan.
Yes, exactly. So I'll give you plus 1200 is how much? 4,000. 3,700. Okay, great. So that's correct. Who is Shahrukh Khan? Yeah. NN?
Systemic.
NN? NN has frozen. NN, go ahead.
We couldn't hear you. Can you say it again?
Innovations.
Innovations in ophthalmology.
Okay. Go ahead, Gunjan.
Only FDA approved gene therapy for retinitis pigmentosa, but only applies to small
Luxturna.
patients with, sorry?
What is Luxturna?
Yes, exactly. NN has got it right. 4,300. What is Luxturna? What is gene Nepar? Okay, cool. Go on, NN. Finish the board, NN.
Ocular manifestations of systemic disorder 1000.
Abnormal DNA repair of UV radiation induced DNA damage, increased skin cancer susceptibility.
This is xeroderma pigmentosa. What is xeroderma? Is the picture shown is xeroderma pigmentosa?
Yes, absolutely correct. What is XP? Xeroderma pigmentosa. Come on, NN. Next.
Trials in ophthalmology 1000.
Gunjan, go ahead.
Among patients with active thyroid eye disease, this resulted in better outcomes with respect to
Trepotumumab.
Who said that?
What is trepotumumab?
Fantastic. That is the trial, optic trial. Okay. What is teprotumumab? Fantastic. And then next cell.
Innovations in ophthalmology.
800,000.
800.
Used to treat ocular hypertension and open angle glaucoma. An actuator button activates the pump to retract the outer sleeve, exposing the inner cannula to inject viscoelastic. Nahi pata. Okay. Anybody flashes? So
glaucoma fellow. We have 2 glaucoma people, right?
I think so. It's okay.
Yeah.
So what is a streamlined surgical system? Single-use device, medical grade stainless steel. It has an outer sleeve, blah, 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 blah. Okay. So now
Menon loses.
Yeah, I subtracted from that. MMJI?
Celebrities 800.
Celebrities 800. Yeah. Little tricky. This James Bond movie actress had to quit her acting career due to ARMD. No answer. Anybody? Okay. Who is Dame Judi Dench? It's a very famous ophthalmic trivia question. There are some things which you should know, like celebrities, and for quiz that is like preparation, you should have prepared. Okay. MMJI, go ahead.
Celebrities.
Go ahead, Gunjan.
This 7-time Grand Slam tennis champion suffers from an autoimmune condition and is a brand ambassador for the awareness campaign of the disease.
Shankara flashed first.
Serena Williams.
Who said that?
Shankara.
Shankara loses points. This MMJI loses points. 1 second. NN has also flashed. NN has also flashed. Go ahead.
NN?
Venus Williams.
Exactly.
Yes.
Exactly. So who is Venus Williams is correct. I think they ruled out one Williams sister for you. And made it
Just answer what was the condition? NN?
Sjogren's.
Yes.
Yeah, superb. Fantastic.
Chocolate for you.
Yeah.
Thank you, ma'am. We'll collect it in YOSI then.
And then your last question, and then go for it. I think NN answered, so 1000.
Yes.
Come on, Gunjan, go ahead.
The brand new refillable ranibizumab approved by US FDA as recently as Feb 5th, 2025. A Konya person knows it. Why don't you know? Retina? Okay, Team SN.
Shankara.
Team Shankara?
Susvimo.
Fantastic. Exactly. What is Susvimo?
Susvimo, yes.
Yeah. Every 6 months you refill it. It's a implantable, refillable implant. Surgically implanted in the eye. Okay, time for Final Jeopardy. Just in time. These are your scores. And if you know the Final Jeopardy correct response, what you have to do is you have to write your response, and below that you have to write the number of points you want to bet. So NN can think anyway I'm winning.
I just wanted to confirm that if I've added the last point.
No, I have not added. I'm sorry. Yeah. So NN can think even if I don't wager anything, I'll win. That's not true. What if SEH wagers 4,200? They will get to 8,400. Okay. So your maximum points, if you bet, can be 6,500 also you can bet if you know the. Okay. Let's go for it. Final Jeopardy.
Take your papers and pen.
You'll have 1.5 minutes to answer. So it's a very simple thing, guys. Trust me, it's not at all difficult. Okay. 1 second. Can you see? Can you see my screen? Not yet.
Not yet.
Okay. Here's your Final Jeopardy question. Okay, ready? We have 1.5 minutes. Your timer starts in some time. Riddle me this. I'm a well-appointed chariot driven by 2 white horses. The one riding me rides upside down. If we split in the middle, you would miss the big picture. Write your question and write the number of points you want to bet for this. If we split me in the middle, you would miss the big picture. I'm a well-appointed chariot driven by 2 horses. The one riding me rides upside down. If we split me in the middle, you would miss the big picture.
We have to write something. Let's see. So
yeah, and then mute yourself. And then mute yourself. Don't stress yourselves. It's simple. It is just like in your brain. You just have to think and bring it onto the paper. It's definitely there.
Can we show the answers?
Can we show our question and answer?
I'm sorry?
Question and answer, like, is it?
They want to show the answer.
Not yet. Wait. Okay. There is more time. We have 20 seconds more to go. No, all of you will answer. Don't worry, it's
Yeah,
not
everyone
answers
has to
first.
answer. You have to
There's
flash the
nobody,
paper
all of you will show the paper, okay?
and with
Nobody,
the marks that you want to
the marks you have to write in below.
below the
Without points, your answer will be disqualified. And I'll cut 1,000 points. You have to tell the number of points you want to wager. Okay? Yeah, we are ready. Show me your answers, please.
all of the teams show the answer with the points that you want to be.
Yeah. Points लिखा है क्या? IDO 20D Shankara and they have wagered
4200.
4200. 2 white horses है क्या IDO में? पता ही नहीं था. और क्या? 4200. Okay. And then don't show me your
Hey,
papers,
hello.
all of you. Hello.
Don't do that.
MMJI, you're losing 1,000 points. You're not showing the paper.
What
Okay,
is
MMJI loses all their
What
points.
is Bearwold?
Then
And then it said, what is Bearwold, right? Bearwold? What is that?
how much have you wagered?
I can't see the number. What is
can't
the
see
mark
the
that
number.
you 100?
100 points. Very good strategy. Okay.
MJ is not showing any paper?
So we'll cut, anyway, they are behind. So we'll cut their points by 1,000. Okay. Any guesses? Anything in hindsight?
Is the big picture. Some value, Pokemon value. It connects.
These are the
All the fibers are crossed. Let's go back. All the fibers are crossed. So whatever rides above goes below. If you split in the middle, you miss the big picture. Bitemporal hemianopia. Okay? Yeah. This is a very good riddle, and actually some of our people got it right when I asked them. So I'm not guilty about giving a difficult question. Sorry.
But I also could guess it without knowing the question.
Yeah, exactly. And then loses 400 points. SEH comes down to 0.
100 points.
100.
100. They said 100.
Yeah. And then loses 100 points. SEH loses all of its points, and MMJI is down by 1,000 points because they did not show anything. Okay, so we come to the end of Jeopardy. Very well done, NN. You have done a great job. Congratulations, Team NN, and Team SEH and MMJ gave a very tough challenge to them. Well done, all of you. I think the best part was that we had a lot of fun in this episode. There was a lot of fun, frolic, and lot of you didn't cut their marks, you didn't cut their marks. Incredibly fun. Thank you for making it so much fun. SPH really deserved, also did a great job, very close, but it's okay. I mean, happens.
They warmed up well. No, in the beginning, when we were asking them, do you want to say anything to any team? So then they were like, silent mode on.
Yeah. So great job, guys.
Great job.
Great job. Thank you so much for joining. I hope you all enjoyed. Doesn't matter if you lose. See you at YOSICon. Maybe you'll get a hot seat entry to the finals anyway. So see you all there. Bye bye. Good night. See you in the next episode.
Thank you, Mata.
I will remember Xenia.
Okay, सब लोग